Thank you for that introduction, Toby. And also thank you, Cross, for having me talk this presentation. So as Toby mentioned, I am a third-year master's student, and this is my actual master's thesis I've been working on for the past few years. The main concept of it is seeing how exercise and cold exposure can work together in order to improve our health benefits through our mitochondria. So just as a quick little breakdown of my presentation, I'm going to start off by just giving a little bit of background information on kind of the literature at hand, so you kind of know what exactly I'm talking about. Then I'll move on to kind of like how we actually conducted our research, followed by some of the findings that we've collected so far, and then discussion on some of the practical applications of this project. So starting off, so this is something you've probably heard before, that the mitochondria is the powerhouse of the cell. But what exactly is a mitochondria? Well, essentially, it's just a small part of our cell that's responsible for producing the energy that we need in order to complete tasks in our everyday life. So similar in the way that a car would run on gasoline in order to function, humans run on a substance called adenosine triphosphate, or ATP, in order to complete our tasks and function just in general. So as we start doing more vigorous, more intense tasks that require more energy to be completed, this is where our mitochondria comes in to produce the energy that's required in order for these tasks to be completed. So due to the mitochondria's role in energy production in the body, it has a direct impact on our overall health as people. So mainly in the way that the more mitochondria that you have in your body, the more energy you'll be able to produce. So one of the ways that we can kind of look at this is it's been associated with higher kind of oxygen consumption levels or a higher VO2 max. Essentially what this means is that it's easier, or you're able to do more difficult tasks a little bit easier, just because you're fully utilizing the oxygen in your body a little bit better. There's also been correlations found between fitness level and overall mitochondrial content. So there's been one study done that kind of looked at athletes of varying skill levels between recreation and near Olympic qualifying athletes. And they found that these Olympic qualifying athletes, their levels of mitochondria are significantly higher in the body than people of minor league athletes. So one way of thinking about it, the more mitochondria you have, the more likely you are to be a professional athlete like LeBron James, and just overall better fitness. On the flip side of this, however, if you have too few mitochondria, you might suffer from something called mitochondrial dysfunction. And essentially what this is due to the overall quantity of mitochondria, you're not able to produce as much energy, which can kind of lead to challenges when it comes to completing tasks. So one thing that's been associated with is increased fatigue. So this can be kind of a hazard in the workplace, because as you're fatigued, you kind of become less aware of your surroundings, and you're more likely to kind of have workplace incidents in these situations. Low mitochondria has also been associated to a variety of diseases ranging from obesity, type 2 diabetes, and heart disease, just to name a few. So overall, it can impact your health, and you're not able to live kind of as healthy and efficiently as you possibly can. Luckily, there is a way that we can kind of prevent mitochondrial dysfunction from happening through a process called mitochondrial biogenesis. And essentially what this is that the mitochondria, it's essentially the process with mitochondria grow and divide in order to increase our overall mitochondrial content. And as I mentioned earlier, the more mitochondria you have in your body, the more energy that you'll be able to have, and you'll be less likely to suffer from some of these mitochondrial dysfunctional conditions. Essentially how the mitochondrial biogenesis process works is it all starts in your cell. So in your cell, there's a variety of genes that are there that work together in order to get a signal to the mitochondria in order for it to know it's time to multiply and divide. So essentially this process starts similar to a domino effect. So the cell undergoes through external stimuli acts on the cell in order to kind of put stress on the cell in order to activate the first set of genes. So as these genes activate, it sends a signal to the next gene to activate, and then so on and so forth down the line until eventually it reaches the mitochondria, and there's more mitochondria increasing in the cell. Although all these genes are really important in the whole process of mitochondrial biogenesis, the main one that we want to focus on is this guy, PGC1 alpha. With this gene, it's the main regulator of the whole system. So if we see kind of this gene activate, we can assume that mitochondrial biogenesis as a whole is happening. As well as this, larger activations of PGC1 alpha will result in more mitochondria being produced as an end product. So essentially, as we can get this gene more active, we can maximize the amount of mitochondria in our bodies. So as I mentioned, like an external stimuli is what kind of gets this whole mitochondrial biogenesis process started. There are different ways that we can use as an external stimuli, but one of the most common ones is exercise, because it has a high kind of energy demands. We can start seeing changes in PGC1 alpha occur after a single exercise bout. Intensity has a strong influence on the expression. So if you're doing something that burns more energy, it will end up resulting in a higher expression of PGC1 alpha occurring as an end result. But at the end of the day, workload is the most important factor. So as long as you're burning like the minimum amount of energy required to get PGC1 alpha to activate, we'll see some benefits occurring with mitochondrial biogenesis in the body. Another method that we can use to activate mitochondrial biogenesis is through cold exposure. So this isn't as strong as exercise, and kind of the research at hand has been kind of mixed on how reliable it is, with some papers showing like an increase occurring with PGC1 alpha expression and other papers showing no increase occurring. But it most likely seems that the cold exposure, the intensity of the cold exposure has an effect on the expression of PGC1 alpha, where if you're not using stimulus that's cold enough, you're not going to be able to see the active changes occurring with PGC1 alpha. So interesting, however, recent studies have shown that by combining cold and exercise together, you can see different expressions of PGC1 alpha occurring. So if you exercise first and then follow it up with a cold exposure, we get an expression of PGC1 alpha that's greater than just doing exercise alone. So the addition of cold kind of does this add-on effect, which will result in a higher level of mitochondria as an end product. If you exercise in the cold, however, you still get this increase in PGC1 alpha occurring, but it's only in line with just normal exercise, so you don't get that additional benefit like in the first situation. As for cold exposure first, followed by exercise, we don't really know what this is, what the result is yet, because nobody's really looked at it, and this is kind of where our study comes in. So kind of the rationale behind this research is we want to try to figure out which method can maximize like our mitochondrial production in the body, so we can get as much mitochondria occurring as quickly as possible. Some of the benefits for this is like, with increased mitochondria, we can improve health and kind of reduce the risk of some of the diseases related with mitochondrial dysfunction. And also with more mitochondria in our body, we have more energy, so it lowers our risk for fatigue occurring and kind of might be able to prevent some of these workplace-related incidences related with fatigue. So our research question going into this would be kind of how pre and post exercise cooling influence the expression of genes involved in mitochondrial biogenesis. And our hypothesis was that mitochondrial biogenesis pathways would be active about the same with pre and post exercise cooling. So for our study, we ended up using recruiting 11 participants for it, 9 males and 2 females. The age of the participants were a little bit younger because we ended up using the university population just because they were the easiest people to kind of work with since it was happening at Laurentian. But the results of this study should still be applicable with older people as well, or workplace aged people as well. So this is kind of our design for the study. It was taken up, so it happened over the course of 2 experimental sessions. During the first session, so before each session, a muscle biopsy and a blood draw was taken for a baseline level. During post-exercise cooling, after the biopsy was done, they underwent an exercise protocol. Before exercise, they ended up doing a 6-minute warm-up on a bike, followed by, or it was a cycling interval exercise program. So After a 6-minute warm-up, they worked at 75% of their maximal effort for 5 minutes, followed by a 1-minute rest, and before returning to another interval, and they did 8 intervals of 75% overall. After exercise was done, a blood draw was taken, and then a 3-hour wait period underwent. So this 3-hour wait period is because the expression of PGC1 alpha is a little bit of delayed response, and it won't appear until it's like full maximal capacity until 3 hours has passed from the initial exercise stimulus. So during this 3-hour wait with post-exercise cooling, they sat in a 0 degrees Celsius environmental chamber until 0.5 degrees Celsius was dropped from their baseline core temperature. After this core temperature drop occurred, they were moved to a thermal neutral or like room temperature area to sit out the remainder of the time before taking a second biopsy. With pre-cooling, the opposite happened. So they started off with being in the cold chamber and dropping 0.5 degrees Celsius from their baseline before doing exercise, which was the same exercise protocol as the post-exercise cooling. Then for their 3-hour wait period, it was done entirely in a room temperature environment before taking the second biopsy and blood sample. So some of the equipment that we use for this study are all listed on the side, but some of the ones I really want to highlight is our environmental chamber. So it's really just like a little room that got cold, and that's kind of how they just kind of sat around in there until they got changes in core temperature occurring. The eye button, so this is what we use to measure skin temperature on the body. So essentially just kind of tape it down to the skin, and then it'll measure changes in skin temperature by various intervals. Finally, we have the Bergstrom needle. So this is how we were able to accomplish our muscle biopsies and kind of get the muscle samples from that. So for the results of our study, I'll start off with kind of changes that we saw during core temperature. So at the bottom of the graph, we have kind of the various time points in the study, and on the left, we have their core temperature in degrees Celsius. With their post-exercise cooling, we can kind of see that the first initial kind of change that was occurred with after post-exercise. So during exercise, core temperature rose as a result of the exercise. Afterwards, you can kind of see the steep decline occur with the core temperature as they were moving in the chamber. After 2 hours, we're seeing significant drops occur with core temperature. With exercise cooling, we kind of see the reverse with an initial drop in core temperature occurring, and then a rise in core temperature after exercise before kind of riding out the wave for the rest of the study while they're in the thermal neutral. So this graph is kind of looking at the specific exercise. So now at the bottom, it's like after each hit interval. So as you can see, with the post-exercise cooling, we kind of have a steady rise occurring throughout the entire exercise duration. But with pre-exercise cooling, our first 2 intervals, we're not seeing much of a change occur. This is mostly because of the decrease in core temperature. As we kind of exercise, we're kind of circulating cold blood in the body, so it's not really causing a rise in core temperature yet. But after the third hit interval, we can kind of see the steady rise occur again because we're kind of recirculating warm blood again. Next is our skin temperature that we saw. So similar to the core temperature, we have our time points on the bottom and then our skin temperature in degrees Celsius on the side. So similar to core temperature, we really start seeing significantly drops in core temperature in skin temperature occur once they are put in that thermal chamber environment. Opposites occur with pre-exercise cooling, where we get that initial drop in skin temperature from cold exposure, and then pretty much a normal skin temperature throughout while they're in the thermal neutral. So these 2 points kind of demonstrate just how fast kind of we lose skin temperature. So with pre-exercise and post-exercise, they were probably in the chamber for roughly 1 to 1.5 hours, but in that time, we're seeing significant decreases in skin temperature from around like 10 to 15 degrees. The final thing I want to show is heart rate. So on the sides, we have our heart rates in beats per minute, and then at the bottom, we have our various time points. So between the 2 studies, between the 2 conditions, not much has really changed. We mostly see a big spike occur with heart rate during exercise because there's a more physical demand on the body to complete the task. So just to kind of look more closely at the heart rate during exercise, we can see there is a slight gap occurring between post and pre-exercise cooling. The reason the pre-exercise cooling is slightly lower is because less blood has to go to the skin in order to kind of like keep you cool. So like as you're kind of exercising, you need to like send more blood to the skin in order to like help you sweat and prevent you from overheating. But since we're kind of starting off at a little bit of a colder core temperature, these changes are able to put less stress on the heart in order to complete that task. As for our muscle and blood samples, unfortunately, due to some COVID-related issues, we're still kind of waiting on our lab to get these back to us. So we don't really know what's happening with what's exactly happening with PGC1 alpha and the various genes yet, but hopefully we will get these answers soon. Just kind of wrapping up with kind of the practical applications for this. As we saw during the exercise, during exercise, heart rate significantly increased as a result of increased energy expenditure. So although there are very few jobs where it's like you're going to be working extremely hard for 1 hour out of the entire day, depending on how physically demanding your job is, throughout an 8-hour shift, you might actually be expending enough energy like throughout the day that you are seeing changes occurring with mitochondrial biogenesis. So as a result of this, like some workers, depending on the physical demands of their job, may be getting some of these like natural mitochondrial biogenesis benefits occurring in their lives, and they're less likely to be suffering from mitochondrial dysfunction. On the opposite end, if you're doing something working more from home or doing a more sedentary job, these risks might be a little bit greater for you. So the best way to avoid this is just trying to encourage workers to be more physically active throughout the day or in their personal life in order just to reduce the risk of some mitochondrial biogenesis or mitochondrial dysfunctional things from occurring. Another thing that we want to look at is cold exposure. So as we kind of saw with that during our study, skin temperature, cold exposure causes decreases to occur in both skin and core temperature in as little as 1 to 2 hours. Although this is kind of like an extreme situation because our participants were in like shorts and a t-shirt and sitting in a 0°C room, and there's not many jobs that will have that as a requirement for them. If you're not properly if you have workers like outside and they're not properly dressed for the weather, these types of situations can easily happen to them as well. If they have a lot of exposed skin or they're just not layered up very well, they can quickly lose skin and core temperature, which will result in impairments in performances, either through less blood flow going to the hands, making fine motor control a little bit more difficult to do, or through shivering and just kind of making it a little bit harder to actually complete a task. So it's most important to do this. So when you have people working outside, it's important for them to be properly dressed for the weather and just to avoid these from happening. The final thing I want to talk about is fatigue. So fatigue in the workplace can be a very dangerous thing. It can impact workers' performance, such as slowing their reaction times or reducing their overall alertness. As a result of these kind of impairments, you can end up, there might be at increased risk for workplace incidences, which might lead to damages on the site or even the workers themselves being hurt during the job. So hopefully what we want to get out of this is that by increasing the amount of mitochondria in our bodies the fastest way possible, we can potentially reduce the risks of these fatigue, or at least kind of limit them, so we can make the workplace a healthier and safer place for everyone. So as I kind of wrap this up, I just want to give a few acknowledgements to my thesis supervisor, Dr. Dominic Gagnon, and my 2 committee members, Dr. Sandra Dorman and Dr. Allison Godwin, as well as my various kind of affiliations with LEAP and CROSH, the people who helped fund, and then the various grad students who helped along with this project. And that's kind of my presentation. So if you have any questions, yeah.
Thanks, Curtis. So I think we've got time for maybe one question, and then if we don't get to any other questions, please throw them in the general chat. And if Curtis is willing, he can stick around and answer them there. So the first question I got was, in the oxygen cascade, is oxygen transfer to the mitochondrial the limiting stage to maximize VO2, or is it the blood supply to the cell lung volume or something else?
It's more oxidative stress that gets sent to the mitochondria, because as you kind of do more like as you do more like aerobic activities, it'll kind of break down the fuels, like the foods that you eat. So like it puts like glucose through a glycolysis process. So kind of the oxidation of glucose will end up sending kind of byproducts to the mitochondria in order to produce that ATP from being produced.